If you ever struggle to understand why people have a problem breaking their patterns, why we can't break our addictions, or why we make choices that keep us in a repeated pattern of struggle, today's conversation is going to be the conversation that's going to change your mind on all of those opinions. Welcome to What's Missing. Today, our guest is Dr. Jyoti Mai, a psychiatrist, addiction specialist, and founder at Manhai Clinic. Thank you so much, ma'am, for being with us today.
Thank you, Ramya, for having me.
Perfect. So I think we'll start off with a question that everybody usually has. When you decided to become a doctor, why did you choose psychiatry and not any other mainstream profession?
Yeah. So I think that's an interesting question to begin with because in our batch of 200, I studied my MBBS in Osmania Medical College, and I was the only one who wanted to take up psychiatry as a specialty. And what inspired me was when we were seeing patients, because we were taught how to treat the body. But what I observed was two people with the same illness, the same problem, but the way they were responding to it and the way sometimes their pain levels and all differed. And also their socioeconomic status and the cultural is different. So the family support systems are different. So I realized that the kind of improvement that one has with the same kind of illness differs. Though understanding brain is complex, but what I felt was understanding the mind is endlessly complex, and I wanted to get into the minds of people and try to understand what's happening there.
So, ma'am, you saw clear evidence that even if they were given the same medication, they still responded to it in a different way.
See, like pain is something which is little intangible, not easily measurable. So the pain levels is difficult to measure between two individuals.
True.
But there is a lot of research which says that people with a lot of stress and depression have a reduced threshold of enduring stress or enduring pain. So we do see that someone who is more stressed can experience a lot of pain, and even though the medication works, but sometimes their responses, might not gel with the treatment that we are giving. So what we call as the sickness role that a person takes. So sometimes a person likes being sick also because they're getting a lot of attention from people. So there can be variations in how you respond to the treatment as well.
Interesting. And when you started studying, ma'am, so just for anyone that's curious and is willing to get into psychology or psychiatry, what do you think is the ideal path? So first you do your MBBS and then you move on to an MD in psychiatry?
Yes. So the medical path is this, that you finish your medicine and then you finish your post-graduation, which is of another 3 years. And then there are some super specialty degrees also in psychiatry, that is child psychiatry, geriatric psychiatry and all, if you want to study further. In psychiatry, basically we are taught to diagnose all the psychiatric disorders, and we are eligible because we are medical doctors. We can also prescribe medications, and we can also clinically correlate because we cannot treat mind separately and we cannot separate the body from the mind. So the recent theories also, you must have heard about the gut-brain axis. See what we eat, the gut, and if at all we are feeling anxious also, it shows up in the gut. Like you can start feeling acidity or you can want to go to the washroom and all. So the gut-brain axis is what is being studied now. And there is evidence that body and mind cannot be treated separately. So I think that way more emphasis on trying to understand both of them should work.
To anybody that's confused, including myself, ma'am, can we differentiate between psychology, psychiatry, therapy, and counseling?
Yes. So this is a confusing field, and believe me, even in the medical specialty, some of my colleagues and doctors sometimes get confused between psychology and psychiatry. So people really sometimes, they call me a psychologist. And just like when we were interns, and when we were interns, we see that patients used to call us sisters, rather than doctors, especially girls who were there. So they get confused. So that made us feel bad. So this confusion arises because of lack of awareness about in the field of mental health, and also because both of the terms also sound similar, psychology and psychiatry. I think that's also one of the reason. But in psychology, they are not medical graduates, but they do a comprehensive study by taking undergraduation in psychology. So they have different courses in psychology.
So MBBS is the differentiating factor there.
MBBS is a differentiating factor, because an MD psychiatry is after an MBBS. They can prescribe medications, but who have done psychology, again there are different fields in psychology also. Like there are some people who do counseling psychology. Counseling psychology, they can only counsel. Counsel means you can instruct or teach them you can give them advices, and but there is a separate field called clinical psychology. So in clinical psychology, the psychologist has been taught about various psychiatric disorders also, and they know how to clinically identify a particular disorder.
Okay.
And they are more adept in actually giving therapies. When you said about what's the difference between therapy and counseling, so mostly sometimes counseling goes a one-way process where you are giving instructions or you are telling what to do. Like you have school counselors, so they talk to the child and they give them some advice and so. But therapy is a two-way process. So it's a two-way process. It's more like a healing. And sometimes therapy can extend up to weeks to months also. So wherein first a rapport is established between the therapist, who is a qualified, mostly clinical psychologist, and then the patient. So after the rapport establishment, then the patient starts telling about the different kinds of therapies: cognitive behavior therapy, dialectical behavior therapy, then psychodynamic therapy. So based on the patient's condition, the therapist chooses a particular therapy and starts with the sessions.
Understood. So to have a clear differentiation, it's only a psychiatrist that can give out medication, is it?
Yes.
They're only qualified to give out
simply
medication.
put it in that way, psychiatrists can prescribe medications. Plus or minus, they can also give counseling and therapy sessions, because we are also trained to do that. And psychologists are trained exclusively for giving therapies and counseling.
Okay. I think that is a question that you've answered for a lot of people. So anybody that's even struggling to find a therapist is often confused. What is my problem? How do I get this diagnosed? First of all, there's so much taboo around it. People are unwilling to go out, and then there is so much confusion. So it will clear out a lot of questions.
So the first step of choosing which mental health professional to go is definitely a problem.
For a lot of people. So ma'am, when you founded Manaha Clinic, right? What was the thing that you thought was missing in general, where you thought you had to go and establish a clinic in a city like Hyderabad, let's say, for example?
So in a city like Hyderabad, because I am placed in Hyderabad, I think that's one of the reasons. But then what I felt was mental health treatments are quite fragmented. Fragmented in the sense, see, someone visits a psychiatrist and they are prescribed medications, and let us say the psychiatrist says ki you need therapies, then they have to go somewhere else for therapies, because psychologists sometimes have their own private practice, or online they can give therapies. And then let us say the psychologist feels ki you might benefit little bit of a weight loss or with some diet therapy and yoga, then they have to visit another place. And let us say it is a condition like dementia or so, sometimes the neurologist opinion also is required. So because of all of this, what happens is somewhere there will be attrition, wherein the patient might drop off from the sessions or anything. So that's the reason I didn't want the treatment, to be fragmented. So then I thought that all in one roof, all at one place, where psychiatrists are available, psychologists are available, and then we have naturopaths or yoga therapists also, and then neurologists, and then including technology. All of this with technology, because there are newer advanced treatments in psychiatry, not just medical, not just psychotherapies, but we have something called RTMS, or repetitive transcranial magnetic stimulation.
What
So
is that?
RTMS is a FDA approved treatment for depression, OCD, anxiety disorders, PTSD, also used in many neurological conditions like stroke rehab and migraine. So we wanted to include this also in all of this. So we also practice these RTMS sessions in our clinic. Yeah.
I suffer with a lot of migraine problems, ma'am. So you're saying there's an actual
Yeah, there
solution,
is
long-term
also
solution to that.
one of the solutions. Yeah, if the medications are not working for you, or you want to try some other options, then definitely RTMS is one treatment module for that.
So, ma'am, over the years, right, like I said, the lack of knowledge is so much that I'm one of the attritioned patients where I didn't know how to find the solution for my migraine. So I just stuck to not like figuring out my triggers and staying away from it. So let's say, for example, a lot of light sometimes triggers it.
Yeah.
A lot of sun triggers it. If someone had an anemic condition, I had a friend who was anemic condition, the lack of iron during a cycle of the month that triggered their migraines. So we just, I think, formed a group and decided to figure out our triggers and just stay away from it. It is actually that fragmented.
Yeah.
So how much do you think is the awareness these days, ma'am? You think we are all like just trying to figure out what is happening to ourselves, or are we actually reaching out? So do you see a real difference?
I think
over the
in
last decade or so?
psychiatry, if we see now, there is a lot of awareness which is coming up. You know, people are talking about mental health. Even celebrities are talking about mental health and depression. So, but we are, I think, still in the stage of awareness increment, but putting into practicality and people where to seek, how to seek help, that has to go a long way still.
So let's say, for example, in terms of numbers, ma'am, you've opened up Manaha in which year?
So we opened up in 2024.
2024. So in the last 2 years, ma'am, did you see an actual difference in terms of the number of people that have reached out, and even for smaller problems? Let's say, for example, things that we usually talk to our friends about, even for that.
So if I speak about my whole practice, that which was 15 years back when I started, to here, definitely there is a good improvement in the number of patients, and also the age group of people who are coming up, because these days I see there are a lot of 10 to 15-year-old kids who are approaching. The parents bring them for treatments. Post COVID also we have seen a lot of surge, about 20% increment, you know, post COVID, because people started talking about reaching out. There were online platforms available. So we have seen a steady rise in the number of patients who have been coming from 2024 to 26.
You've actually brought up a really interesting topic, that post-COVID, or let's say, for example, kids who are younger than the generations previously, they're mostly reaching out, if I can just reframe it. So just to be the devil's advocate here, do you think it's trendy in some form to say that I'm depressed or I'm anxious, or do you think it's a real increase in numbers that's also happening nowadays?
I think it's both, because there's definitely children pick up words like depressed and ADHD, you know, all of this. And there is a lot of Western culture, also Western influence these days in cities and all, if we see, when a child talks about being depressed and having ADHD especially. So, and also there is a real surge of numbers also.
Is it?
The reason is, see, there's a lot of globalization these days. So, as much as fast as the technology is increasing, our human brains, our nervous system is made up to take in so much and so. So what happens is, with so much of advanced technology, our brains won't be able to get in sync, or, you know, keep pace with the speed. So sometimes that causes a lot of, the person can get overwhelmed, has to speed up. Like earlier, people used to work between 9 to 4, but now the work timings are erratic, and one is supposed to work for 18 hours or 19 hours. There's no limit. And then there is a fear of job loss if you don't work. So there's a lot of competition, a lot of comparisons. You have to keep pace with everything. You need to admit your child in so and so school, and then you need to keep up with your status. So I think there's a lot that this generation, these days we have to take in. So that is why there is definitely a increase in surge of depression and anxiety. And also in young population, they use these words very casually. Uh, but they might not really be diagnosed depressed or ADHD, but we do see these conversations happening between them.
To just digress a little bit of the conversation, ma'am, these are just my thoughts. So feel free to like correct them if I'm wrong. When you're saying all these small triggers, right? That's what you're talking about. Like I have anxiety that I might lose my job. It might not be anxiety in that moment, but I'm sure it builds up and your nervous system tries to hold on to everything all at once, like my job, my career, my physical health, my kids, their school. So you think at any of these micro points, before finally getting to a point where I have a panic or an anxiety attack, do you think there's any tips where I can, like, let's say, do a breathing exercise, or let's say tell myself that this is not the end of my life? Anything that we can actually practice at these micro triggers before we actually have the real anxious in life in general?
So, yes, actually these days they are being taught in school also for children. I think they'll have to first practice all of this. So one is the simple breathing exercises. Let us say you think that you're getting restless or the stress is building up. So you can just concentrate on a slow breathing. Because what happens is when you're anxious, the breathing becomes shallow. Sometimes you become breathless. So concentrate on the breathing. Let us say 1 to 4 you're breathing in, 1 to 6 you're breathing out. So it should be a slow thing, 1, 2, 3, 4, breathe in, then breathe out slowly. So for 5 minutes at least you can concentrate on that. So what happens is it slowly calms down the brain also. And then another thing what you can do is the grounding exercises. There is something, if you must have heard about 5, 4, 3, 2, 1 technique, wherein you are concentrating all your sensory organs to be present in the present.
Okay.
So let us say you're seeing, we ask them that if you're getting stressed, to try to, because what happens is either you're thinking about something which has happened or something which is going to happen. So concentrate on the present, like see 5 objects.
Okay.
And hear 4 things, something that you are able to hear now. And touch 3 things, or smell 2 things, taste 1 thing. So just try to do all of see that all your sensory organs are connected to the present. So this also sometimes helps, when you're grounding yourself to be there in the current. So we can practice these few things.
Interesting. Like, would you suggest trying to physically also ground yourself? I've heard somewhere that hugging a pillow or just hugging yourself and sitting down in a position also helps.
People do practice them. Certainly, coping strategies might be individualized, because some people might benefit with, hugging things, like soft toys and all. And we have also seen some negative coping strategies, which a person should be very careful about. So these are positive, where you're hugging some soft object and doing that. But sometimes, people resort to self-harm and all, which is also their coping strategy. They feel relieved after doing it. I see a lot of young population doing it. So I think we need to create awareness, or parents have to be more mindful of what their kids are doing in terms of coping strategy to reduce their anxiety.
Ma'am, if it's okay, can you explain that? How, what is a person feeling that if they kind of cause some pain to themselves, it feels like a relief?
It's like a self-directed anger. They have a lot of frustration and anger pent up. So a child sometimes might not know where to show that anger. So maybe some children shout or cry, but some just keep everything inside. And then sometimes they don't know where to target it. So they target their own body. So we call, this is their developing personality, which we call as emotionally unstable or borderline personality traits, which a person is developing. Because as they are growing up, because of lack of the coping strategies and maybe a lot of stress or pressure, these days, feeling of missing out, all of this, and they don't know what to do. And then they can pick up a pencil or something and start hitting themselves or hitting their hands or heads. So we have seen quite a raise of these cases these days.
So it's similar to a tantrum, ma'am, when a kid is 2 years old, but when you're older, you have more.
Yeah. So you have more control over what you, and you decide what to do. And sometimes you don't know that it is actually harming you more. And you don't show it unless the parent, sees that there are some marks and all.
That's really unfortunate, ma'am. So, just as an advice for anyone going through that, they should really try to first reach out to anyone possible.
Yes.
Without
So I think because of lack of awareness again, I think schools have to also create awareness and let the child know, especially into teenagers who are there. Mostly we see beyond 11 years and all, help is available. It's like you're suffering with so and so condition, please talk to us. Please come to the school counselor and talk to us, or talk to your parent or friend, where they can kind of guide them properly.
Just to again deviate and go on to the other side of the spectrum, we are too quick to diagnose other people. So if we just deep dive into any comment section on any post on social media, we will see people diagnosing another person. So for example, the word narcissist is thrown around so easily.
Yeah.
But just to understand the gravity of that word, ma'am, what is a true narcissist like?
So usually, like you said, people also casually use this word narcissist. So in narcissism, this person will have a raised sense of self-esteem, or they will try to project them in a very grandiose way. But actually, really speaking, they have a very low self-image. So they have self-esteem issues, but then they want the projection will be in that way. And also they lack empathy and they are very sensitive to criticism. Then they fall under this category. With their relationships are also sometimes very unstable, and they want to show authority and they want to dominate and they want a lot of appreciation always. You always have to praise them. So which is not possible when you are in a relationship. It can't be always one way. So it leads to a lot of problems.
But not everyone's ex is a narcissist just because they're broken.
Because there are specific standardized assessment scales, which we call as personality assessment scales, which will properly diagnose what personality traits you have, or whether those traits fall into disorder. These are two things. See, you might have a trait of being excessively clean, like you like everything in symmetrical and everything in a proper clean way. But then if it exceeds a particular thing, it becomes a disorder. So a trait is okay. So we have to properly diagnose this condition by doing these assessment scales. And then because these are all standardized scales, so then you will get a complete report of what traits you have, whether you fall under a disorder or not. So I think anyone who is confused about what their traits or what their partner's traits could be, they can get these personality assessments done.
But not everyone is open to getting them done also.
Not everyone is open. The correct path is to go through this way.
To go through that. Interesting. And a lot of times, ma'am, do you see a pattern when people are choosing partners, or when people are choosing similar kinds of relationships in their lives across the board?
Yeah. See, what happens is when you are grown in a particular, like Indian culture, let us see, and then your childhood experiences also influence a lot in the way you choose your partner.
For example?
So I have seen that many people who are in a childhood where it was neglected.
Okay.
So then they tend to get attracted to people who like give them more attention or praise them a lot. So though they know that this particular partner is dominating or authoritative, but any small attention also, they kind of get attracted to them more. So if there is not a proper parental attachment in childhood. So, and also familiarity is another one. When you know people very well also, sometimes you get used to being, familiar. So, and also in that age, you do not have the right decision making, like in your late teens and early 20s, sometimes, you get attracted to people. So when you think, oh, there's a lot of emotional connectivity between both of us, so we are made for each other and all, and then later realize it is not so. These things happen.
So how would you suggest people break these patterns? Like someone might just repeatedly choose a toxic relationship just because they're unaware, or is it so deeply wired into you that you can't get it out of your system?
So it's a simple question, but the answer is not very simple. Because how to break away from a toxic relationship? So there are many reasons that people still are in relationships which are toxic for years together. There are so many reasons. So see, one reason could be having children.
Okay.
So you have a child with them, and then you don't want to come out of it because your culture doesn't, allow you to be separate. There's financial dependence. Not all are financially independent, so they might wish to stay in a relationship for the financial benefit. And then there is something like loneliness. You don't want to go, you don't want to take any other like new step, because okay, now this partner, I got used to him or her, so let me be with him or her. So they don't want to do any other risk taking. So there are so many reasons that they stay back. But then I think everything should begin with in the beginning of the relationship only. The boundaries should be set. Okay, this is what, or you need to do the talking, and just don't let the other person completely take over you. And what happens is, after a few years, you just become helpless.
Interesting point you said, Mom, that we have to set boundaries in the beginning of every relationship. Do you feel particularly like everything that you've talked about now, let's say, for example, kids or financial dependency, it's majorly affected the women. So do you also think because of that, women have more difficulty setting these boundaries?
We have, because like you see that the country that we live in, India, so it's majorly it's a patriarchal society that we live in. And women are taught from the beginning to be kind, to be affectionate, to be caring, and then you do have all of these pictures of women being Durga,
Mother
with so
Teresa.
many hands. You are doing 10 or 20 works at a time and elevating the status of women to a goddess. So I think what is the required is not to make women goddess or something. Let them be human, and let them also cry out, let them also talk openly about it. And if they have a problem in a relationship, let them talk about it and tell, no, I cannot do this. This is so much so that I can do even the works outside or inside. So I think the human side of women is people lack to recognize it, and women themselves also, because they are taught and they have seen their mothers also doing the same. So they have a lot of guilt feelings when they kind of say no to something, like, oh, I can't do anything. They won't say that. They always take up all the roles. Though the trend is changing, these days we find a different, completely different pattern. But then still, majority of the women are like that.
Just to understand the trend, ma'am, as an opinion, even if not as a professional opinion, do you think it is mandatory for us to swing from one extreme to another extreme before we find a balance?
I didn't understand.
So let's say, for example, if we are going from doing 10 things without saying anything, is it possible that we first swing to the other extreme where we say no to mostly everything, and then possibly come to a middle ground where we find a balance of, okay, these I can push my boundaries, these I cannot?
Yeah. So ideally, what I think is, what you are talking about is the black and white shades of, completely you're not doing something or you're doing something. Yes. But majorly, all our lives, I think every day we go through gray shades. I think people have to accept gray shades in people. The day that you accept ki, I have these gray shades, some negatives, some positives, and the other person also has, it becomes easy. But those extremes and all are not what are required. I think what the situation demands, based on that, you need to choose what you'll have to do.
Okay, perfect. I think that's a great advice, ma'am, because we usually don't tend to understand how to say no because we were never taught that.
Yeah.
And we go on to saying no to everything.
Correct.
Now that we're learning to say no, we're like,
Yeah.
no, I cannot do that. I don't want to do this. This is not. And also, it's become a trend on, again, social media that I'm going to save my energies, not let you intrude, not push me. And I feel like these are somehow taking away from the human side of relationships altogether, where a little bit of compromise is what keeps any friendship, relationship, or family going.
Yeah.
To that extent. Ma'am, one final question of the segment. It's something I think everyone has gone through. So, why does it physically hurt when you're mentally hurting. If I'm breaking away from a relationship, if a family broke, someone near to me died, why is it physically painful even in those situations?
Yeah. So here again, like, earlier we spoke, the body and the mind connection. So in the neural networks, so there is no discrimination between it's a physical pain or it's a psychological pain. So when like any grief reaction happens, you have lost someone. So definitely it becomes very painful for the person because the emotional center of the brain is activated, and thus, everything becomes numb in the brain, and you tend to become very dull, and your pain threshold also comes down. So that's the reason, if a person has any major life events, like it could be a breakup, then you stop eating properly, you don't sleep properly, this in turn increases most of your other bodily pains and all of these problems. And then headaches can come, a lot of tension headaches. What we say is backside of the neck and shoulders regions, if it's there, so that is indication of having tension headaches.
Okay.
And we have a condition wherein earlier when we spoke about migraine also, the one of the main triggers is lack of sleep and stress. That any stress, any anxiety, the migraine triggers can come, the headaches can come. So there's definitely a correlation between both of them. We just have to identify and likewise practice a proper healthy lifestyle also to reduce these things.
As we've discussed all of these possible scenarios where people, A, due to lack of awareness, or B, due to a taboo, or C, just ignorance might be, they don't know how to deal with certain micro triggers, like we discussed previously. So we have a small this or that, so it'll probably help people make better choices. What do you think we should choose, peace or passion?
So I think we have to choose peace finally at the end of the day. But if you use your passion properly with appropriate peace, I think that would be better.
Okay, I think that's very well said, ma'am. Logic or emotion?
This is something difficult to answer, but you need to have the wisdom to choose one in a particular situation, either of the one. Because sometimes you can't be always only logical. The relationships will go back. So either emotion or logic, but based on the situation. You need to know when to choose what.
Healing or looking for closure?
Healing, I think. See, closure is not always ideally possible. So healing gives its own closure.
Independence or interdependence?
Definitely interdependence, because we human beings can't thrive alone. So we have to be connected with each other.
Interdependence. But in a scenario where unfortunately you're in a bad relationship, don't you think independence is better now?
See, in a relationship is there, but this person can have other relationship outside of this relationship. So interdependence with some other relationship or support system is required.
Having a support system is more important. Showing strength or showing vulnerability?
I think vulnerability is also a kind of a strength, because when you are open and honest about your emotions, that shows the real strength. But if you're masking and you're trying to be strong, again, that's a problem.
Okay.
Yeah.
So true strength that
is vulnerability.
Forgiveness or setting boundaries preemptively?
Setting boundaries always. Forgive or not comes later on.
Done. Finding happiness or finding meaning?
Finding meaning, but we always run behind happiness, but finding meaning is more important.
Self-love or self-awareness?
Self-awareness always.
Being understood or being accepted?
Being accepted works more. And because we are social human beings, if we are not accepted in a particular group or so, we kind of feel very lonely. Understanding also comes at a later stage after you're accepted in something.
Wonderful. So, ma'am, as an addiction psychiatrist, what addictions do you think are rapidly growing nowadays?
See, earlier there used to be only substance abuse or substance addiction. Substance meaning a lot of alcohol, nicotine, smoking, and all of this. But these days we see that cannabis addictions have increased in the young population, along with the digital media addictions.
Mom,
So,
explain digital media addiction.
with this a lot of social media and also everyone wants to be done, and then a lot of social media apps also. So we see not only the young population but adults, everyone are slowly getting dependent on them. So there is a difference between usage, abuse and dependence. So when we call someone as dependent, and earlier psychiatric diagnosis never included internet addictions, but we see that recently, few years back, they have included it as a disorder, which is called as internet use disorder.
Okay.
So that is also a disorder, because the pathways of the brain, same like how in alcohol and nicotine, in the dependence or addiction pathways, whatever are involved, which is increasing the dopamine, the same pathways are found to be, or similar pathways are found to be acting in the internet use disorders or the digital media addictions, what we call. Kind of scrolling any reels on Insta, and then it is giving you some satisfaction or some pleasure, seeing all of them. So the same, it's giving you 100x pleasure. But let us say if you're studying, and after studying you'll get your rank or result after a few months. So this is a delayed kind of a gratification. So you're getting immediate gratification in the social media. So people tend to go with immediate gratifications. No one wants to wait. No one wants to be patient. So no one wants to go with a lesser dopamine surge. So people want to. That is how children, adults, everyone are getting dependent on them.
And it affects children and adults in the same way, ma'am?
See, not in the same way, because when you see the children's brain is still developing. So almost till 24 to 25 years, our prefrontal cortex, which we call, that is the front side of the brain. So this is still developing. So when I say developing, and this prefrontal cortex is responsible for decision making and impulse control and proper planning and execution. So these areas will be affected. Once when you're in the growing stage and you're completely in the virtual world and you're dependent on them, you're not making human to human connections properly. So obviously the development of this brain will be lagging. So there will be a problem in controlling your impulses. So you can be very frustrated, angry, and there will be a problem in decision making. So you can be taking very impulsive decisions. Even planning and execution you won't be able to do properly. So I think in a child's brain it is more dangerous.
Mom, how does it happen? Like you said, there's a difference between usage, dependency, and addiction.
Yeah.
Why do we get to the addiction stage?
Usage is okay, you're using it, at the same time your other functionalities are intact. You're doing your other works also well. But when we call something as dependent, there are few major signs and symptoms that you need to look to. One is craving. There'll be a lot of craving. Like even though you are doing some other work, your mind is occupied with that. Just like in alcohol, like you're not drinking but you want to go, you think about alcohol,
Or
you think about a smoke, even for smoking. So same thing, this also, your mind is, you're working somewhere but you're craving for it. Your body, your mind wants it. So craving is one thing. Second thing is, despite knowing it is harmful, you tend to take it. That is the second thing. Person is dependent on something. So despite knowing the harm, you want to use it. You know it's harming you, but still you want to use it. Just like in smoking cigarettes, there is a sign written, okay, this is harmful, it causes cancer, but a person still takes it. So that is another thing, criteria. And then the third is impairment in other functionality. That is, your interpersonal difficulties come. Like the whole day you're watching something, and then you're not taking care of your household chores, or you're not taking your responsibilities.
Job.
So continuously you're binge watching some OTT, let us say 24 hours, 48 hours, you just want to watch, and nothing is being taken care of, right? So at the cost of the other activities also, the person does it. Then there is another important thing called withdrawal. Withdrawal means you are removed. Suddenly someone takes away that particular thing. Then you become very anxious, restless. Those are the withdrawal symptoms. You want it. You become angry. You become agitated. You can't concentrate on anything else unless you are given that. So that is another criteria where there is withdrawal symptoms. And in substance, then you have something called tolerance. Tolerance means you have to increase the amount
of
as
dosage.
days goes by. Otherwise, you don't get the same effect.
Interesting, ma'am. So, as a specialist, I'm sure it's very easy for you to get to a point where you realize that, okay, this is what is happening.
Yeah.
As common people, ma'am, if we have a family or a friend that is, and we don't even know what all addictions are possible. So, any early on signs, ma'am, that we can say, okay, even if we don't know if it's a substance or an internet or an app or a game, how do we still try and understand early changes in behavior?
So early changes, one thing is the person's mood, changes in the mood. Like you're getting very irritable for very minute things. You're getting very frustrated, angry, or withdrawn, completely isolated. Like you're calling someone to come for some party or some function. They'll always avoid it. Earlier they used to come, but now they are not coming. Or they are being very silent. They are not constant. Their academic performance, becomes low. That is another thing, sign that we can see. And then they're avoiding people is another one. And another thing is the biological functions also get disturbed. You can see that this person is not eating properly. Or there can be opposite thing of binge eating. You order something and you're just eating a lot. That is another sign that to say that there is something wrong with this person. And sleep also. Sleep will be very much compromised with people who have these addictions. They won't be able to sleep well. So I think these are some things, the mood changes, the behavior changes, the academic performance or the work performance getting low, the lot of conflicts in relationships. These are something that we need to look out for.
And ma'am, once we realize, do you think confrontation is the best thing to do at that point if it's an adult, let's say, for example?
See, confronting someone always leads to a negative response only. But I think we need to talk to that person about what our observations are. Trying to ask them, trying to make them realize that we think something is wrong with you or you're suffering in a way. So we need to ask them, is there anything wrong? Can we help you in any way? So we think you need help. So I think these conversations we need to start with the individual.
And how much does a person change, ma'am, in addiction? Like, are they going to become a completely different person? Because while researching for what all we're going to talk about today, I went down a lot of Reddit threads where there were a lot of grieving families that said, we just don't know this person anymore.
Yes, they completely changed because see these days, then the social media, I had 2 patients who had a severe gambling disorder. They had in the internet only. There was a site which they had to keep money.
Oh.
So there was some sport or something where they have to keep money and bet on something. So it was some kind of a game. So where they had to put money. So it comes under the gambling disorder. So they had taken a lot of debts and loans outside, and it was a very bright child actually, around 16 years. So till 16 years the child was fine, but after that got into this and then taken loans or debts from random people, and then it went on to lakhs of rupees, and then the parents couldn't stop him in any way. But I think if people realize that it is a psychiatric disorder actually, that they are not able to come out of it, they'll just go deep into it. So, but if we treat them properly, there are proper medications to treat these disorders, so we can definitely get them out.
What does it look like, ma'am, the treatment of
it is a mixture of both medical and non-medical, because we also have to do the behavior therapy. We need to target with giving them impulse control medications as well if they have gambling disorders and other impulse control problems.
Is the recovery real? Like, is there a chance of relapse?
There definitely, for all addictions, there is a chance of relapse. Because see, when we try to treat a person the biopsychosocial way, sometimes the social thing, goes missing. Like you're biologically treating the person, you're psychologically giving therapies, but the social situations might not be conducive.
In the sense?
In the sense, sites or the internet is openly available. And let us say the families are
unaware.
Not only unaware, but they have a lot of conflicts in the family. The family support system is missing. Let us say a lot of parental conflicts, and this child just wants to get distracted by getting into something. So if it still persists, then it becomes very difficult. Yeah.
So the triggers for relapse also
We need to
be
identify all of those triggers, and we can prevent the relapses from happening if a long-term kind of commitment they are giving for therapy and all, and they come regularly, we can definitely prevent relapses.
With respect to addiction, we'll do a small segment of, if possible, one word only.
Okay.
So that A, it will be easier for people to be aware.
Okay.
B, it will be easier for them to recognize anybody that's being harmed around them. So addiction is?
So it's captivity.
It's captive, like they're
Yeah, capt. Yeah.
very unfortunate. Recovery is?
So recovery is like a release or a return.
From the...
Yeah, getting out.
Beautiful. Relapses?
So relapse is again taking a detour, getting again into that captivity.
But it's possible.
Yeah,
Even do they realize, ma'am, that it's captivity?
Some do, some do, some don't.
Dopamine is?
It's a drive, motivation.
Alcohol is?
It is numbing. Eventually, it will numb your brain.
Gambling is?
So gambling is a mirage. People think so you'll get something out of it, but you're not getting.
Social media is?
It's noise. Full of noise.
Is that what helps you also numb your brain in a way? That noise?
Yes. It's a lot of overwhelming information, right?
Pornography is?
It's a distortion.
Of reality.
Distortion of people tend to get pleasure somehow. You know, they have to, so they tend to find ways which are available. So that is what they do. And they never realize when they are completely into it.
Therapy is?
So therapy is realization, understanding yourself.
It's a two-way process?
Yes.
Mandatory. Medication is?
It's a support system, I feel.
It's not the solution.
Not the complete solution, because when we are treating minds, it is always a comprehensive treatment we have to do, considering the social situation, family, and everything.
Discipline is?
Practice. You need to practice discipline.
Willpower is?
Willpower is the fuel. It'll keep you running. Yeah.
Shame is?
Silence. People feel isolated.
It should be something that we actively work against.
Yeah.
Healing is?
Again, recovery and accepting yourself, understanding yourself.
Beautifully said, ma'am. So, ma'am, in all of these years, 15 years of practice, do you think people truly change, or we just like become more aware of handling ourselves socially?
See, just like how our body changes, everything changes with age, with circumstances. So I think what you were when you were a 10-year-old, now you're not there anymore. So I think the situation, circumstances teach us a lot. Toxic people around us teach us a lot. You develop a coping strategies, how to avoid them later on. So all of life struggles and battles teach us a lot. So eventually I think people, they evolve, you know, mentally also they evolve in a positive or in a negative way it can be, but the evolution and the change does happen.
Ma'am, after you enter adulthood, let's say for example 30, 35, 40, even at that point is change possible?
So it is little difficult because when we call the neuroplasticity of the brain, for younger adults, like earlier I had told, no, below 25 and all, it is easier that we can make modifications. But in adulthood also, with therapies and all, what we try to change is the way they are thinking, their cognitive distortions that they have. We can try to make modifications. So little bit modifications in your personality is possible. But given that you have insight, you agree for it, you want change. Let us say you don't want change and you don't have insight into your problem, no one can do anything. That's the obstacle.
But isn't ignorance bliss, ma'am?
Bliss for you, but not for the other person, right? The family suffers.
In all of these years of talking to so many people now, not just patients, but I'm sure you have so many panels that you discuss on, so many professionals that you talk to. At the end of the day, what do you think everyone is looking for?
See, everyone is looking for validation. They also are looking for some kind of a peace, contentment. Sometimes people themselves don't know what they want. So they are running after something, like when we call it as an ambition. I want to become this, I want to become that. But finally, after reaching that, still you are not content or happy. So I think there is something higher, like a self-realization, or you also have to know where you need to pause, where you need to stop. You can't be always running.
If we're constantly, let's say, for example, seeking validation or seeking peace, will we truly get it, ma'am?
So it's up to us to understand. See, always like external validation is another thing, internal is another thing. So I think always we look for the external more, and sometimes we might not get it. So you should be understanding yourself much better, and you should know okay, what where you're going is the right path. I think that gives more meaning to your life.
To end our conversation for today, as a parting gift to all of our viewers, one thing that you would like to tell anybody that is struggling with the smallest of the mental health issues?
Yeah. So one thing is, please go seek for help. Well, while it is in the early stage, don't wait till the symptoms increase a lot, and please talk about your issue to someone. Because these days no one has the time to pause and ask you, are you okay? Are you doing fine? So you have to tell or explain your problem to the other person by yourself. So please talk about your problem. Don't keep it to yourself, and understand that problems do come. We cannot completely avoid problems, and emotions like anxiety, sadness will always be there, because life is a roller coaster. It goes up and down, and healing or recovery always doesn't go with a straight line. But any progress that you're making, those small progress is progress. So be hopeful.
Wonderful. Thank you so much for joining us today, ma'am. It was a
Thank you so
wonderful
much.
conversation.
Same here.